It started with a billboard at Montrose and Lions Creek Road. Today, Health Minister Deb Matthews officially announced Niagara South Hospital.
We're announcing $26.2 million as a planning grant to take the next big step forward in determining what services would be located in a new hospital, what are the physical demands of those new services, locations of the hospital and 2 new urgent care centers. So this is a lot of money that's going to be invested. It's the next step in building a brand new hospital in Niagara.
And with the billboard going up last year and now this announcement, it kind of caught people by surprise. Can you describe the process coming up to this announcement?
I appointed Dr. Smith, Kevin Smith, to be supervisor of NHS almost 2.5 years ago. He came back with a report, and after he did his analysis of the NHS, his recommendation was that we build a new hospital in South Niagara. That was a very big recommendation, but he made a very compelling case.
The project was the brainchild of Kevin Smith. He felt the future needs of Niagara South could only be met with new facilities.
So you're very kind to suggest it was mine. I really reflected in the report what I heard over and over and over again from the 2,000 odd folks that we heard from during our 2-year process. And again, we talked about evidence-based care, ensuring high quality of work life, ensuring high customer patient satisfaction, looking at what the future of healthcare is likely to look like with new technologies, changes from things that were once done in hospital to the community. So it really is a reflection of what both is happening in the environment of healthcare, as well as what's happening with the science and technology of producing care, not only in hospitals, but in the community.
And you mentioned new technology, new services. What are some of the things you're at least hoping for with this project?
So we're continuing to look at things like, for example, could we do more home monitoring of patients who were once in hospital? Could we ask questions about whether perhaps you were once seen in a hospital and treated in a hospital? Could that be done in a more ambulatory environment? Or could we look at expanded roles in family health teams taking on things that perhaps historically others did? Just as we've seen in our obstetrical program, the enhancement of home births with midwives. All of those kinds of questions I think are really important as we go forward in the next evolution of the NHS.
But only in the planning stages, today's announcement means South Niagara will receive a new hospital and 2 urgent care centers. Smith says current facilities' futures will be evaluated as the project reaches completion.
It's a very important component. I think we heard loudly and clearly, particularly from those communities who perceived some of the changes as potentially anxiety-producing, that their greatest anxiety was around urgent and emergent care. So urgent care centers are a very important ingredient. I think the other piece that's very important is our emergency medical services partners. And Niagara has a very, very robust EMS system, one of Ontario's largest number of advanced care paramedics. So again, we're trying to build a system. We're not only trying to build a hospital.
The people of Niagara deserve and demand the highest quality of health care, and they're going to get exactly that in this new building. You know, we're already very blessed with the people who are working in our healthcare system here in Niagara, and now we're going to give them the facility that will make it an even better patient experience.
The project will now head into the planning phase. Minister Matthews feels the new facilities will mean that Niagara residents will get the best possible care. Reporting for The Source, I'm Mike Morgan.